On this episode of 6-1 Forward, I'm joined by Michael Corey, Executive Director of the Human Services Chamber. We've talked about transit in the past, housing, development projects. Now it's time to talk about the impact of what's going on across the country and within the state of Ohio and locally to the people within our own community. So Michael's here today to talk about what's happening as it relates to nonprofits. But before we talk about that, can you share a little bit about your trajectory from Duke University to the executive director of a nonprofit and what the Human Services Chamber is?
Sure. Well, thank you so much for having me. I'm a recovering lawyer. I have to start with that.
Sure.
I went to Duke in 2001, which feels like both yesterday and a couple centuries ago. And I knew only that I was excited to be a student and didn't precisely know what I wanted to be. I was pre-med, and that lasted about a week. Chemistry class took care of that ambition for me. I got into journalism. I got really into education policy and was just trying to figure it out. And by the time I concluded, I knew that I wanted to address inequities in some way. At the time, the focus point was through journalism on the educational system. That was the goal. And there isn't a path for that. So I moved back home to Columbus. My father had just passed away a couple months prior to graduation. I wanted to be home for lots of reasons. And I started working at something called the Ohio Board of Regents, which doesn't really exist anymore.
Yeah, that's something you used to hear about, but not so much now.
Yep. If it does exist, I don't know.
Sure.
Which perhaps says enough. And I was a consultant for them. I just did whatever they needed me to do as sort of a utility player, and I loved it. But I knew pretty quickly I needed to deepen my education in some formal way if I wanted to stay on that trajectory. So I left after a year to go to grad school at Ohio State in education policy. I was there for about 14 months and loved it and got my MA. And the timing was such that I had kind of an off year before I could start law school, which I decided I needed to go to while I was in grad school. So I went to law school at Ohio State as well, and knew by then I really definitely wanted to be in the education law and policy space. And I went to the law firm, Bricker and Eckler, that had successfully challenged the way we funded public schools back in the day. And I got there as a new lawyer, and they said, "We have no business for you in education. You're going to be a healthcare lawyer." So I went into their healthcare law practice and was learning the ropes. The people were wonderful and very patient with me as I tried to figure out what I could do. And I pretended to love it as long as I could, and finally started looking for something else and found the Children's Defense Fund of Ohio, and went there in 2015 doing policy work. And it was my dream job on paper. It was addressing the inequities in our system. I thought I'll be here for a very long time. And I got there, it was mostly healthcare work again.
Oh, geez.
Very different kind of healthcare than what I had been doing in private practice. But I loved it. I loved trying to help navigate Medicaid challenges and food stamp access and things of that nature. But it coincided with the rise of a certain presidential candidate. And I felt morally compelled to do what I could to prevent that person from entering office. So I went and worked on another person's presidential campaign doing voter protection work. And obviously that did not go the way that I thought that it would, and had an unintended sabbatical in my career. My wife and I had just been married for a year at that point, and my in-laws thought that I was a crazy person trying to make these changes, but took a moment to try to figure out what I wanted to do next to be helpful, particularly helpful for what I thought were going to be the unique challenges ahead of us, given the policy priorities of that incoming administration. And at the time, I didn't really have an expertise that I could shop myself to. I was a generalist lawyer. I dabbled in some nonprofit work. I had never managed a team or a big budget, and I was in my 30s.
Right.
So what am I doing? And a lot of folks would talk to me for a minute and then say, but you haven't done all these things. That's going to be a challenge for our board to hire you. So I was getting close to starting my own thing with no credibility. And then I found a posting on idealist.org for the Human Service Chamber. And I'd never heard of it before, but I loved what I saw on paper with that. It's an organization that's helping nonprofits. Yeah. And it was a one person, one full-time employee. So I didn't have to worry about managing a big team, nor did the hiring committee. And it was a tiny budget. So they didn't have to worry about me messing up a budget. And I was energetic and passionate, if nothing else. And they weren't immediately turned off by those things. And they've been stuck with me since then.
What year was that you joined the Human Services Chamber?
April of 2017.
Okay. And back then, how many members were within the association?
We had 48 organizations at the time.
Wow. And today it stands at?
About 220.
220 nonprofits within Franklin County.
Yeah. So they have to be 501c3 organizations either providing or supporting health and human services work in Franklin County. But they're as diverse in the work that they do as they are in where they do it and the people that they serve. We have a lot of organizations that are very small, that don't even have an employee, that are all volunteer run, and that only exist in one location or even online in Central Ohio or Franklin County. We have organizations that are part of a national apparatus, and there's a local affiliate here. And we have some national nonprofits that are based in Columbus that we get to support as well. So they really run the gamut from agencies with revenue of a couple $1,000s to $400 million a year.
And can you talk a little bit about what those organizations are doing to support or be a safety net within Franklin County?
Sure. So they are the safety net. And though we don't represent every single health and human services nonprofit, we're pretty close at this point. They're doing the things you would imagine in basic needs: housing, healthcare, food, education, et cetera. But there are all sorts of other elements of the health and human services sector that are baked into this. Legal services, immigration services, criminal justice programming, reentry services, a ton of workforce programming, lots of organizations in developmental disabilities, lots of in-school, after-school, summer school type programming. We have a lot of organizations in the cancer space in some form or another, a lot of health equity organizations. We have two organizations that just do volunteerism. They facilitate volunteer programs for nonprofits. We have advocacy organizations that kind of run the gamut. Who am I forgetting? We have an organization that addresses gambling challenges. We have a victims association in the membership now. We have a few organizations that are primarily arts organizations, but have really robust programming for health and human services in some form or another. So it's a really wonderful array of nonprofits that we get to serve that's reflective of the diversity of the community and the needs that this community still got.
Is the Human Services Chamber, do they act as an advocate on behalf of when it comes to funding, or what is the driver of the Human Services Chamber?
Yeah, great question. So yes, and. It was created in 2010 with one primary mission, and that was to do advocacy with and for the health and human services organizations. And that mostly meant local government engagement. And that mostly meant asking city and county officials for money. There were some ambitions that the initial founders had for what it could evolve into, but those weren't really manifesting until COVID hit. When COVID hit, we were doing the advocacy at the state and federal levels too, and we decided we needed to do a lot more to help our organization. So we started adding professional services and capacity building resources. That continues to be a huge driver of our work. And we started distributing free stuff. At the time, it was masks, gloves, soap, sanitizer. We've distributed so much PPE that we just stopped counting. And we do all sorts of other things. Whatever nonprofits tell us they need, we try to figure out how can we be of assistance. But our bedrock purpose is the advocacy piece with and for the organizations.
Part of the reason why I had reached out to you and was really hopeful that you would have this conversation with me is because I was seeing you in different places and your willingness to speak truth and to speak loudly. And nonprofits, I don't know that everyone might know, can't say the things necessarily because their funding is tied to X. And so they have to walk a very, very, very tight rope. Whereas you have the freedom and the ability, and you make good use of that freedom and ability. And I think that's incredibly important.
That's generous. Thank you.
If I may,
no,
you're
please.
using a lot of different avenues to do that. And maybe if you could talk about just this year, what some of those conversations and maybe the truths that you've had to speak on behalf of other people.
Has something been happening?
I don't know. Maybe I'm hoping you'll let us know.
So we are both a C4 and C3 organization. So I'm a lawyer. We have to start with the legal status. A C4 basically gives an organization a lot of latitude with how it spends its time and what it's saying and doing with that time. A C4 organization can spend 100% of its time telling legislators what to pass and what not to pass. They can also endorse candidates and things like that. We've never dabbled with that. And we don't spend even 10% of our time doing advocacy, strict advocacy by the legal definition. But we do plenty of that. C3 organizations, there's a very nebulous line in the sand of how much time a nonprofit can spend doing advocacy. They can do it. They can absolutely tell a lawmaker, please vote for this or please don't vote for that. But the nebulous line is approximately 20% of their time. Most C3 organizations don't come close to that out of fear of potential legal ramifications. In this environment, in what's been happening in this year, where the threat of prosecution or investigation is weighing heavily on anyone for saying just about anything that certain folks won't like, a lot of folks have retreated from having perspectives that are public on advocacy issues, especially in the nonprofit and some other spaces, because their revenue streams are reliant upon either directly or indirectly government dollars. And the mere prospect of being investigated by, say, a state attorney general or a U.S. attorney or the Department of Justice directly out of D.C. is far too great a risk for any nonprofit organization or their board to want to even tiptoe around. So it's been painful watching organizations have to slow down on their advocacy for the work that they do and the people that they serve because they're afraid of retribution, but it's absolutely happened.
I wanted to ask you about that. When you and I spoke, gosh, it might have been 2 months ago, if not longer, the first question I asked was, how are you? So I'm curious, how are you today, and how are the executive directors and the people within the nonprofit world? How are people?
Home is good, and I'm privileged to have that.
Sure.
That to look forward to and be comforted by. My wife, who's in the nonprofit sector, and we've got 2 little boys, and they are cathartic, even though that shouldn't be the first thing that comes to mind. They are. But to actually answer your question, this is as bad a moment as it's been for nonprofits, and it's a very, very difficult time here and across the United States. And there are all sorts of reasons for that. To level set a little bit, we do a state of the sector survey every summer just to see where our members are at across the board. Normal things like how many people do you employ, what's your revenue look like for the year, boring stuff, but census type material. And we always ask, how do you think things are going and what are some of your challenges? And every year since we started doing that in 2020, it's not been great. But at least in 2020 and 2021, as hard as those years were, there was a bipartisan government attempt to navigate the moment with nonprofits as partners. And that has changed. And that is why things are so tough. We just finished our State of the Sector survey yesterday. And out of all of our responses on the simple question of how would you rate the state of the sector now, 65% say they rate the sector as bad or worse. We've never had anything close to that in terms of the percentages being so negative. And that is because of the abnormal stuff that's happening. So what's the abnormal stuff that's happening? It primarily is this unprecedented attempt to retreat from federal government investments in nonprofits and in the people they serve through the social safety net. We started funding nonprofits in the 60s with the war on poverty, with direct and indirect grants. We've obviously been investing a lot in programs that encompass the social safety net that are part of a nonprofit revenue stream, Medicaid and food stamps being key ones. And all of those things are under unique duress and have been since January 20th at about 12:01 p.m. So that alone has posed enormous challenges, but the targeting of nonprofits on top of that attack on their business model has been really, really challenging. For example, there was an executive letter issued on February 7th, I think, that very succinctly said, we're going to look at every penny going to nonprofits to ensure it's consistent with the national interest. So nonprofits are scared.
Right.
While they're trying to meet the demand that is going up, while the supply of resources to meet that demand is going down and will continue going down over the next few years as some of the initial budgets that have gotten through the federal government and the state government start to have an effect. So it's very, very tough.
You've been in public policy, nonprofit, politics. You probably had an idea of what was coming.
Yes.
So there, I'm sure, were moments where there were shocks.
Yes.
But I'm thinking about from January on, as prepared as you could possibly be going into that.
Yeah.
Where were the moments? What were the moments that were really sort of the or the fear or the anxiety? Those pivotal moments for you this year.
Great
so
question.
far, by the way, it's just the end of
That's
July.
Right. Oh. Yeah, this year has been a long decade. So the first one was January 27th. That evening, a story leaked to the Washington Post that the government was going to initiate a federal funding freeze on all nonprofits. And that sent absolute shockwaves throughout the nonprofit ecosystem across the United States. It was mercifully blocked in 2 federal courts. We'll come back to that. But that was a holy shit moment for the entire country, and certainly for us in Franklin County. And we scrambled to figure out what the impact of that might be had that been allowed to come to fruition. And to wit, the administration circumvented those court orders in a lot of ways. Just 2 weeks ago, they stopped the flow of $7 billion that technically is in violation of that court order. But the administration just kind of gone, stop us. Right? That was number one. Number two was a Sunday evening when Elon Musk, who was then still immersed in the administration, illegally, in my opinion, posted a tweet to his dozens of millions of followers that had a screenshot with one of our members' names in it, within social services choices. And at the time, he was saying he was going through and just pressing a button to cancel funding for all these organizations across the United States. So there was this scramble to figure out what exactly the Department of Government Efficiency was doing and what Elon Musk and his, team of 17-year-olds was doing behind some computer screen, cutting off funds. That was not expected. We did not see that coming. And mercifully, some of those pieces have abated, but they're not done yet. And I think the third moment was the false hope we got that we might be able to block the Medicaid cuts, because we had a number of Republican lawmakers, including one of Ohio's U.S. senators, both of whom are brand new, telling us and telling anyone that would listen, we're not going to touch Medicaid, we're going to leave it alone. In fact, the White House had put out a very vulgar statement, don't F with Medicaid. And that was quoted in a news article, and one of Ohio's senators retweeted that and said, correct. And we thought, okay. And we had great conversations with his staff about it. And when it came time to vote, voted to cut $1 trillion in Medicaid. So I think those are the 3 moments that stand out the most at this point. The next one will be when they reinstitute the federal funding freeze. There was a Supreme Court ruling, which itself was jarring, that said federal district courts can't stop the administration across the country, even though they might determine they violated the law, can't do injunctions. And that ruling by the Supreme Court will essentially invalidate the injunction that's been in place in 2 federal courts to stop the federal funding freeze. The day after that Supreme Court ruling, Donald Trump himself came out and said, that's one of the things we're going to now return to. They haven't filed the paperwork in court yet. They've been a little busy. I'll leave that alone. Mm-hmm. They'll go back to that soon. So we're just kind of waiting on bated breath for that shoe to drop.
We have the budget, the bill, the big, beautiful bill. Yep. The budget has passed.
Yep.
We aren't seeing necessarily instantaneous outcomes from that,
right.
Impact from that. So I think sometimes it's hard for people to visualize, or it's an abstract thing.
Absolutely.
If you were to try and describe it, if you were to try and I don't want to use the word predict because I think people sometimes shy away from that. But if there are things that we should be prepared for, or ways that the city is going to look different, people within the city will look different, or Franklin County, I'd love to hear what your thoughts are on that.
Yeah, sure. So ever since January 20th, and certainly since the federal funding freeze started, the question from everyone, including within our membership, has been, what's the amount of impact and when will we feel it? And it's very hard to pin anything down with specificity right now. I couldn't even tell you today how many federal grants to our members were in fact cut off or delayed, because many were cut off and then it started flowing again, and there's lots of uncertainty. So if the Federal Reserve can't predict 3 months out, we certainly can't. But I can try to answer this with a little bit more specificity than that. So we've been describing all of this as sort of a series of cascades going toward a waterfall, right, where you go off the cliff. And the first cliff was the federal funding freeze, and obviously the water calmed after that for a little bit. The series of little cascades since then have been the quiet siphoning of funds or cutting off of funds from specific federal agencies. The third has been specific agencies themselves just shrinking down to complete dysfunction, many of which are really essential to the nonprofit community. But the really big first cascade will be kind of very soon for immigrants who are here legally.
Can you say that part again?
Yeah, legally residing immigrants who will no longer have access to SNAP and food stamps. There was just a story that we did on that in the Dispatch, I think last week. That was the one piece that's going to affect folks right away.
And when is that?
Today.
Today.
Tomorrow, whenever folks start to enforce that. We're not sure. Then over the course of the next couple of years, there are requirements that restrict access to Medicaid and to SNAP that will start becoming effective. So between now and 2028, there will just be these cascades we go down just on those pieces. When the fiscal year ends and active federal grants end, there's no litigation that can be filed to keep dollars flowing. So that's another piece that we're watching later this year going into next year. What will the agencies fund? What eligibility for those dollars might they change? Anybody that has anything remotely DEI related has had to change their language already to avoid losing funds or being investigated. So there's pieces like that. They're also going after other federal investments right now through the appropriations process. They're going to go after HUD money, housing and urban development. That's a ton of affordable housing and rental support money. They're going to go after childcare and Head Start. They're going to go after money for disability services. They're going after something as simple and uncontroversial as money to help people pay for the utilities bills. The HEAP program is zeroed out in the president's discretionary budget. So all of that will be determine in the next couple of months too. Whatever else they decide they want to rescind, because they can do that. They just did that with money for PBS, excuse me. CBS
That's
is also on my mind. That's right. So there's just this holy crap amount of stuff that's going to shift. And at this point, it's hard to pinpoint with precision where the dollars will dry up and where they might flow in another secretive way or a way that we can get around. The only thing we know for sure is that every city and county across the United States will see hundreds of millions, if not billions of dollars less from the federal government over the next 12 to 18 months.
And when you use a stat like that, or a dollar amount, which is staggering, by the way, is it safe to assume that cities, counties, municipalities, they don't have the funding to stop the gap?
No,
cover the gap?
It's part of why this is such an existential COVID-like moment. There's nothing anybody can do to ease that transition. There is nothing that can be cobbled together to match the amount of federal money alone that's going to be lost, certainly not on this timeline. And that's the thing. If this was happening over decades, sure, you make adjustments, you evolve, you innovate, you come up with new structures and whatnot. But to do it this fast, to this degree, across the board, there's no way cities and counties can do it. And this is the question being navigated in every city and county across the United States right now, especially the larger communities. How do they make up for the lost resources that are going to be lost while direct resources to people are drying up too? So there will be coordination amongst cities and counties to figure this out. It hasn't really started yet. Everyone's still knocked back by the legislation that just passed and was signed into law July 4th. But it is the generational challenge right now. And to give you a sense of how we're all kind of figuring this out in real time, we're ahead of the game in Columbus because, in a bit of good timing, the city of Columbus and Franklin County have already convened a group to generate ideas for how we might come up with new revenue streams with taxpayer dollars to support not only nonprofits, but arts and tourism. And they hope to have recommendations published by the end of the year. I've got to present to them in a couple of weeks. Most communities are flailing a little bit. They don't have infrastructure in place to at least come up with ideas yet. So I'm grateful for that. But I just emailed folks at Harvard Business School because they run a program called the Young American Leadership Program. Very wonderful program, very generous, that pulls together leaders from multiple sectors every year. And I asked some of the folks that run that program, are you aware of anything in any city right now where there's some substance to it? Or are we all just kind of figuring it out? And the answer was, we're all just kind of figuring it out.
To that point, you and I have talked previously, people I know, groups of people, and the question seems to be, what will need coverage first from an individual donation standpoint, and where are dollars most desperate? There's also a sense of, if I know that these things are covered, I will then devote my resources to this thing. But in the absence of knowing, is there coverage for everything? Will people be able to? How are you answering that or guiding people through that?
Yeah, it's tough. Is
it everything?
It's eventually everything. Yes. So let me buy myself some time, and then I'll get to the question. So importantly, it's not just nonprofits and the people they employ and serve that are under unique duress. They're going after a diverse array of chunks of the economy. Higher education is obviously a big target of these folks. Law firms have been coerced in a way that no one thought they could be and have flailed largely in response to that. Institutes of research, tremendous duress. Hospitals, certainly local government has been under a unique attack from this administration. The arts, it's a lot of the economy is trying to figure this out. So nonprofits specifically the nonprofit sector is huge and very diverse, as we've discussed. And some subsectors of the nonprofit community have been targeted first and more aggressively than others. So that's kind of how I answer the question, because in a way, you're asking me which son is my favorite. But the subsector of nonprofits that was targeted first were those serving refugees and resettling them. The refugee resettlement program, which started under President Reagan and has enjoyed bipartisan support all the way until January 2017, and then again during the Biden administration, they functionally stopped almost immediately. And then other programs supporting refugees and immigrants have been under funding duress from the feds as well over the last 6 months. Of all of the subsectors, that one probably needs the most support right now. Any organization serving immigrants and refugees. After that, there's this big chunk of organizations that have been getting punched in the mouth by the federal government and could probably benefit from sustained support from people looking for organizations to write checks to and to volunteer with. Behavioral health organizations, thanks to the Medicaid cuts that are coming. Food pantries, they're slammed. They were slammed before this year, and now they're going to be slammed and without the resources to respond, and therefore food banks as well. Those are two different things, right? I would say organizations that are in the any space that has to do with diversity, equity, and inclusion, any equity type organizations. I've got at least one organization that's changed its name already just because it feared it might become a target of investigation. And there are funders that have moved their money away for fear that they would be investigated for giving money to an organization with an ethnicity or a gender in the name of it. So that implies the next piece, any LGBTQ plus serving organization, they need support right now. But then interestingly, there are these other areas where the funding is being targeted. So one of our members is the Breathing Association. Another is Impact Community Action. They both administer the utility supports program. If that money goes away, that's a huge line of revenue for those organizations. They don't get any more. But you wouldn't think on paper they'd be under unique duress from this administration, ideologically or otherwise. Organizations that benefit from or support cancer research, because there are enormous cancer research cuts and other cuts in the NIH budget. That's 5 of our members that you wouldn't think about. And to give you a sense of just how broad this all is, 2 days ago, I emailed 4 of our members who have coffee as part of their revenue stream, because we have an inexplicable tariff on Brazil that will drive up the price of coffee. And there's a new lawsuit filed by the Orange Juice Association challenging it because orange juice is another piece that will be directly affected by the tariff on Brazil. So I said, watch this, and this might affect your bottom line. So it's a little bit of everybody, but there are a couple of initial tiers that are easily identified as this cascades out. But there won't be a nonprofit that's going to be safe or unaffected, because you take so much money out so fast from one subsector or a few subsectors, that affects the whole because it's all intertwined. And that's the part that a lot of folks don't necessarily think about. If an organization that provides after-school services is defunded for whatever reason, think about the ripple effect of that. Someone that was getting support after school no longer has a place to go. What happens when someone doesn't have a place to go? Not good things.
Right.
What do they get when they're there? They get food, they get camaraderie, they get development, et cetera. That's enormous. All by itself, just that one little thread that we pull on. Food pantry piece is an enormous one with tentacles that are wide. And the housing piece is an enormous one. So we're doing all of these things at a time when we should be pouring more into it. And sure, there are efficiencies that we can be exploring. There are innovations that we can be exploring. But we're taking what was a difficult situation and would have been a difficult situation under a Harris administration or whomever. And we've decided to just, let me say it this way. We're going from incidental challenges to intentional ones.
That's a really good way to put it.
And I think that poses a challenge for everyone. How do we respond to something like that?
Well, I think that's how I'd kind of like to wrap this up, which is people are looking for their call to action.
Yeah.
And if I were to ask Michael Corey, what is the call to action?
The short answer is every act of helping helps. Whatever that is, because everyone's got different priorities they have to be cognizant of, every act of helping will help. Whether it's time, money, talent, advocacy, but we all have to reprioritize what we do and the way we approach this stuff right now, because the challenges are existential. They're existential, and they are now generational. This doesn't all go back to normal after an election or two. We have changed the structure, and therefore we have to change our structures in response to that. And none of that is said with any partisan bent. It's just what's happening and what we have to do. Do we want to make sure people are still fed or not? I think that we do, but we can't do it the way we've done it before, with so much money no longer being available for it. But at the end of the day, the big systemic thing we have to do is we have to be willing to align our advocacy with our actions. And a lot of times folks will like certain things and support certain things, but then turn around and either ignore or advocate not as thoughtfully as we need them to. You can't care about people that are hungry and then support someone voting for something to make more people hungry.
That's right. That's right. Well, my perspective and my personal belief is we are fortunate to have your voice in Columbus, in Central Ohio, in Franklin County. It's critical. And I have been, as I've been following you, I've learned a lot. I think other people can learn a lot. And as we close the episode today, I always ask, what do you think, or how would you describe the Columbus way?
Yeah.
As it relates to nonprofits, maybe?
Yeah.
Or the work that you do, what is the Columbus way to you?
Well, we're going to find out right now. If the Columbus way stands for nothing else, it has to stand for responding as a community to a moment of crisis. We did it the first year of the pandemic. In particular, not one major nonprofit closed in 2020.
Wow.
Find me a sector in our economy where not one organization closed because of COVID and that collapse. Everyone rallied, and we directed dollars in a way that we didn't have to ensure that the nonprofit community was intact and able to meet the surge of need that we had then. That isn't happening yet, but it will. This community is going to come together and figure this out, but we're kind of getting everybody on the same page right now. Unlike the first year of the pandemic, unlike other challenges that bring people together or opportunities that do, this isn't affecting everybody the same way at the same time. People are starting to get it, though. People are starting to get it. And I think, to me, the Columbus way is turning those challenges into opportunities for everybody, with everybody at the table to solve them. That's the Columbus way at its best. It doesn't always happen that way for one reason or another, not for negative ones necessarily. But if we're going to redefine that, I think this is the moment to do it. And I still very much believe, this is an incredible city.
It is.
And I still believe Columbus has a chance to show the rest of the continent what a 21st century city can look like. But if we're going to figure that out, it's going to be now. Because our city is a lot more like the rest of the country's cities than the cities that have defined and led the way for cities up until now. We're not New York, we're not Boston, we're not DC, we're not Chicago, we're not LA. We don't have some of that infrastructure that has made those cities great. But now that's, in part, an anchor for them in a negative way. We don't have a subway system. We don't have mass transit. But those technologies are about to become antiquated. Instead, we have massive sprawl. But we also have done something, like us, that has a lot of potential, just as technology is going to create some solutions for us. We have to do that cognizant of the other big challenges ahead of us that we haven't talked about, AI, global warming. But if we rally and figure this out together, we can do this in a way that the rest of the country is like, oh, Columbus figured it out. I think we can do that. I think we're on the precipice of doing that, but we're not there just yet.
I look forward to following along your advocacy and your updates, and hopefully have a conversation again here, maybe next year, see an update, and hopefully find some positives that are coming out of this, and that people are in fact going to find the support that they need. Thank you so much for being here today. I really appreciate it.
Thank you.
Thank you.